Thanks so much for joining me today, Tanasi.
Pleasure to be here.
If you could give an introduction as to what you do today and how did you get here?
Yeah. I spend about 40% of my time looking at investments with Halo Health and Genesis Ventures as a venture partner for Genesis Ventures, looking at all of their health tech portfolio. And Halo Health, I'm the chair of the board. Just as background, Genesis Ventures is a generalist fund out of Greece, investing globally in Greek founders mostly, or at least companies willing to have a presence in Greece. Recently listed by Sifted as top five most active investors in Europe. And Halo Health is Canada's physician angel group. And we have about 400 members who are actively investing, and we've invested in close to 50 companies so far with five exits.
What are some similarities and differences you see in the European or the Greek way of investing in startups versus the Canadian way?
The Canadian ecosystem is much more mature compared to the Greek ecosystem. About 10 years ago, we were barely starting to see an ecosystem with the first fund being created at the time, that the first private fund. There was maybe one public fund that was created in 2011, whereas venture capital has been in Canada for decades. So being less mature means smaller check sizes, smaller risk appetite, smaller exits. Everything's just smaller, but growing fairly quickly.
And
Fairly. We hit an upswing in 2021, and then like a lot of things in venture, it's stalled a little bit since then.
was the plan to always transition to venture from being a physician? And if not, like, was there a moment or what made you realize that, maybe I want to branch out and I want to branch out into investing in startups, not something else?
So I still maintain a small clinical practice, and it was not the plan. No, I practiced more than full time for 11, 12 years. At the tail end of that, I started working for a startup called Dialogue, which ended up IPOing in 2001. So I joined in early 2018. They went in their seed phase, stage, and then they IPO'd 3 years later in the big health tech boom. So there I got to see a different way of doing things, much more agile, much more innovative, different attitudes. And that's how I got introduced to the world of startups. So investing was something that I was doing by myself in the public markets before that, but startups was through working at Dialogue. And as of 2020, I started looking into angel investing. I got to really educate myself through Halo Health, and then I started writing checks as of 2021.
Talk to me a bit more about the mindset as a physician and as an investor in startups. From my experience, med school teaches you to be the anti-entrepreneur, the anti-VC, to minimize to minimize risk at all costs. And even the way we think, when a patient comes in, my thought process in urgent care in a walk-in is always, is this going to harm this patient? Is this going to lead to a loss of life or limb within the next 24 hours? And then that timeline expands. Is this something here that's going to cause morbidity over the next 6 months? And then is this cancer? So it's a very I don't want to use the word pessimist, but it's a very risk mitigation approach to work and to practice. Whereas venture is often about, what is the upside here? How big can this be? Right? And we understand risks are inherent in venture and we accept them. Whereas medicine, the type of thinking is very different. So talk to me about how did you find, maybe through your work in Dialogue and then Halo Health and Genesis, like, what are your thoughts on the shift in mindset between the two practices you do?
Um, I think the closest parallel would be it's as if you're dealing with very undifferentiated patients all the time. So a startup, when you see a pitch deck, you you're not sure what the outcome's going to be. There are plenty of risks, and you just have to price in and minimize as many of the risks as possible. The team, the market, the product, the technical due diligence, um, how well the team members know each other, not if they're just qualified to be in that market. And you have to look for asymmetric bets. So I'm gonna write a check for this much, but if this goes well, how big could this be? Whereas in medicine, you're still mitigating risks if we're talking about undifferentiated, undifferentiated situations, and not, your routine cases that you would see in a walk-in clinic or in any kind of settings. But in medicine, there's no upside. You're just capping your downside, and then that's a different way of doing things. You do not get rewarded for taking risks. You get slapped on the wrist for taking risks. In venture, if you mitigate risks well enough, um, you can get rewarded quite a bit, and it's also a numbers game. So you do your 10 investments, 6 go to zero, not a problem. You get your one or two that give you 100x, you're in the top 25%. In medicine, 6 of your diagnoses are are not right. You're looking at some complications. Well, that's a difference. So it's still making decisions on incomplete information. It's still mitigating risk, but the overall philosophy is very, very different.
What advice do you have for non-clinical investors who want to invest in healthcare?
Um, so if we're talking about digital health here or medical device, um, technology is good, and good technology is useful, but hospitals, physicians, they don't pay for good technology. They pay for a solution to the problem, and you need to offer that solution, and you need to be able to integrate it into the daily workflow as seamlessly as possible. So unless you're willing to do that integration from A to Z and minimize friction as much as possible for everyone involved, whether that's the physician or the clinician who's using it, the patient, the administrative staff, your good and impressive technology is not going to get you anywhere. So this is the important thing that I would look at as an investor looking into digital health companies.
You have two investment opportunities. One is an amazing team, but with a crappy product you don't think fits the market. You don't think maybe will get adoption in healthcare, but the team is an amazing team. Team B is not such a great team, but their product is something that fits your thesis. It's an opportunity you've identified, and it's a really good product, and it solves the problem. Who do you pick?
Can I just ask a qualifying question? What do you mean a good team?
So a team that understands distribution and product iteration, and a team that maybe has some experience selling into healthcare,
Yeah.
and a team that has experience maybe building software solutions adjacent to healthcare.
All right. So I think it's an easy answer for me. Team all the way, team all the way. And I've had some recent examples, recent examples that remind me of that. So product is one thing, and then timing and why now, answering all of that is great. But if the team is not agile enough, is not resilient enough, you're not going to get anywhere, even if you have the best expert or the best product.
How do you test for that agility and resilience?
Um, it's it's an art, right? There's no silver bullet here. Um, you have to, during your interactions, your multiple interactions with them, you have to ask them some challenging questions. You have to see how they respond. You have to ask them questions about their past, how they dealt with different challenges, especially work related challenges when it comes to this, and then sort of get a feel for how, if they're more of a missionary or a mercenary type of person, where they're looking for missionary being, I believe in this company and I will do whatever it takes for to see this materialize and to see my product being used by my patients or clinicians, versus, oh, the metrics are good and hopefully we're gonna exit in X amount of years for this valuation. um so yeah, it's a bit of an art. Resilience is important. Having some kind of founder market fit, and well, yeah, and high IQ, obviously, and high EQ. So the way that they answer your questions when they get challenged, that's gonna be a big. Um,
And what are some common objective attributes you've seen in your successful founders? Are they a certain age? Do they come from a certain area? Have they had certain life experiences? Maybe they used to play video games. I think that's talked about quite a bit in the VC ecosystem. Or they maybe, failed a grade in school. Or are there any commonalities you found?
um, yeah, a chip on your shoulder does help a little bit. Yeah, I have to say, yeah, so being smart, having a bit of a chip, is wanting to stand out. I think one of the smartest founders that I've backed is a middle child in a family of doctors who kind of abandoned the pre-med path and then decided to go into banking, investment banking, which she had to explain to her family why it's great. And then once they realized that it's great, and then she has a great salary, she's like, oh well, I want to do a startup. And she's just raised an oversubscribed Series A. So that definitely helps. But I wish it was that easy to tell you.
Yeah, I think it's something I've kind of recognized. I've taken the bet on, I have these theses in mind, and I don't know if it's something I should continue doing. It's largely to paint a story for my LPs and my syndicate investors. I find if I tell them I'm just going to invest in the best team, right? I'm going to invest in the best founders building in healthcare. That is my whole thesis. That doesn't fly well.
Yeah,
It
yeah, yeah.
doesn't resonate. So I have to kind of say, okay, I'm looking for inbox management and AI diagnostics, or the ambient scribe plus, which is what is the additional features here, or the AI physician, or scheduling, or whatever it is, RCM. I need these theses, or the investors who invest in us, they don't buy a vision. Do you kind of find that being part of Halo Health and talking to physicians, like, is thesis driven investment the way? What are your thoughts on that?
Um, yeah, that's a great question. So there is the prepared mind approach, where you look into a market and you build your own thesis, and then you look for companies specifically that solve the problems, um, which is great. It has worked for big funds. I think Excel was known for that. But at the same time, try doing that exercise going back in November of 2022 and saying, I'm looking for this. And then in January, well, OpenAI is here, right? So you would have to adjust quite a bit. So it is a bit of, it is a mix of things, but I do like to have a basic, yeah, a basic idea, basic investment thesis, but then really team is the right team in a big-ish market. That's the biggest driver as far as I'm concerned. And then market is always, it's also hard to pinpoint, because the market can increase, the right product can increase a market just by being so great and having more people use it.
When we're speaking last year, we made a prediction that there will be at least one AI scribe unicorn. There's been multiple, and I got close into getting into one of them, but I didn't have access to capital, so I couldn't get in. Um, but that would have been a good investment if I did. Um, what are some, so to follow on that, what are some predictions you are kind of seeing at this point, and I'll kind of share mine after.
Yeah, yeah, yeah. So I think the AI Scribe Plus is here already. So we're gonna have AI scribes that are just linked with AI agents, and basically everything that the physician does, other than say this is the diagnosis and this is the plan, is gonna be automated. So uh, you would see a physician would see a patient, go through the interview, come up with a diagnosis and then plan, and just say to the computer or to his cell phone, this is the diagnosis, this is the plan. Organize a consultation with this person. Organize a consultation with that person, and I'll see you in 3 weeks. And then everything after that is going to get done. So the appointment is going to get automated. The medication is going to be sent to the patient. There's going to be direct messages back to the physician if there is an adverse reaction. There's going to be an AI agent that calls you and tells you exactly where you need to go, what you need to do in plain language that you understand, and gets a feel if you're anxious or you're not anxious, and is able to troubleshoot some basic problems and then only escalate to the physician if and only the AI agent cannot do it. And then AI agents already are quite good. When you talk to them, it is they feel quite natural, and then they're able to deal with even you asking them relevant questions or you interrupting the conversation. So I think all of that is going to get automated. So for I think for the first time, we're going to have software that makes your life easier and doesn't increase the amount of things that you need to do. Obviously, it's not going to happen all at once, and it's not going to happen. It's not going to be evenly distributed, but I think we're there.
I completely agree. And do you think this will be several point solutions like AI for prescription generation and everything that happens after that, AI for referrals? Or do you kind of foresee one company taking on everything that happens during a physician visit and follow up? And then that ties into patient inbound as well and AI agents for, because this is
Yeah,
a
yeah.
cycle, right?
There's also inbound. Yes, yes, and
Yeah.
even invested in one of those actually for inbound. Um, it's tough to know what the market's going to do, but probably two or three big players that end up consolidating the smaller players. I think that's how I see it. I don't know if the big players are going to start off as scribes or agents and then move into the other direction. But yeah,
And does the defensibility here lies in the tech or the distribution?
I would have to say distribution, unless one product is significantly better than the other. But I think distribution is probably going to be where it's at.
And what are some hurdles you're seeing for something like this? Say like an AI automated AI agent that does my referrals and prescriptions for me. Like why doesn't that exist right now? Is it a technical problem? Is it a regulatory problem? Because I don't need I'll happily pay for this. I don't need to make money off this, right? Like AI scribes, I don't make any money off them. And that's, in the past, I would have said, if you're not generating revenue for me, I likely will not use your solution. I've changed my mind on that because the pain point with paperwork and referrals and referral rejection, and, I get this because I'm still in clinic once a day. This referral was rejected. Please send it to someone else. And it's literally 15 clicks and copy pasting five different things and attaching the documents. It's like 10 minutes of my time, which should be one click.
Um, Sorry, can we go back to the question? So the question is, what's the difficulty?
Yeah, is it a technical problem at this point? Because before you said that the defensibility lies in the distribution, not in the tech. So to follow on that, and I agree with that. Is this a technical problem currently, or is this more of a regulatory problem? about generating prescriptions and the agent needing a license maybe to prescribe certain medications, and what's the path to that? Yeah.
Um, uh, I don't know if it's a false dichotomy. I think it's a little bit of so technically the technology is almost there. I know a startup that does just integrates all of your software in one, so you don't have to do 15 clicks, but you're not able to talk to it, right? So technically, the technology is almost there, but there's a lot of point solutions. So integrating all of that into to customizing that to what you need, that's tough. Regulatory, yeah. So in terms of regulatory hurdles, they're fairly big, and mostly it has to do with different geographies and different regulatory rules. Um, and then there is, how to integrate workflow. So there's the clinical that inertia, the status quo that becomes that's still a problem. So it's a combination of things, but I think you have to. I think if you're able to prove to clinicians that you're saving them time, you're providing value that's 10x what they're doing right now, it's not going to be that's going to help a lot. But I think if you have your champion, that's the best way to do go to market. If you have one or two champions per institution, they're going to be able to move things along.
When do you think we will see the first AI agent getting a license to practice something in healthcare? Be it counseling, be it physical therapy, be it like prescribing a medication or birth control. When do you think that will happen? And what's the path to that? If I'm a founder and I'm like, I speak to ChatGPT or Gemini,
Yeah,
or an AI agent, I'm like, this is really helpful. I would love for this to be my counselor and be reimbursed by insurance. And the barrier being that it needs to be a registered healthcare AI agent, professional. Like, what is the path to that? When do we see that? And am I thinking of this the right way? Because my thinking is you need that license to unlock revenue.
I agree.
Yeah.
I agree. I agree. I don't know if it's easy to make that prediction because um, there's the issue of liability and a lot of healthcare delivery is personal and people like the human touch. So I could see it, let's say over the next 5 years, being authorized for represcriptions or and in a really menial task. So or represcription of an OCP or a contraceptive. I could see it maybe treating something really really simple like a benign, like a recurrent rash, for example, so like another eczema flare up. But I think for the most part, the the lowest hanging fruit is administrative tasks and administrative costs that have increased quite a bit in North America now, and I'm guessing in other markets as well. So that one, I think it's a safer bet. Now, yeah, getting a full license, that's a harder one. And there was also a recent publication, I think in the New England, where uh, chatting with a chatbot, with a therapist chatbot, was shown to be non-inferior, I think, to compared to chatting with a therapist. Even with that, I don't think that's enough to change the status quo in the near future. Like, and by near, I mean in the 2020s.
Yeah, I mean, I've been talking to Gemini quite a bit. It always tells me I'm smart and ask very interesting
Yeah.
questions. Um, yeah, and then so I think that the motivational interviewing techniques are built in these chatbots, which is very interesting. And I had a conversation with an AI agent, which was a networking thing, and it made me feel good. Um, I don't know if it's good for me to be validated that much, but it made me feel good because the constant validation also will reduce your stress tolerance, or when you get a negative feedback, you won't be used to it because your counselor or your best friend or this is something we're seeing, your partner who's an AI agent in some cases is not providing any constructive feedback. um, is that something you kind of think about? And like with the rise of AI agents, how do you see the future of mental health?
Um, so that's an interesting question because we had that discussion with a portfolio company at Genesis. My honest opinion is that I don't see them replacing a human therapist completely over at least over the next 5 years. I'm willing to bet some money on that, let's say. But it
And
is
why not?
you still need that resistance. You still need someone to go against to push against your assumptions, your schemas, your defense, your ego defense mechanisms. You still need that, and
So do you foresee like payers saying you need that to get better? Like, do you foresee like data coming out that patients love it, and like I love talking to Gemini, but it's not helping my mental health, even though I love it? Like, is that kind of you see that data coming out at some point?
you need a study that shows that outcomes over a long period of time are comparable or better. And maybe AI is gonna go quickly, but there's a lot of nonverbal communication that you cannot input into Chat GPT, the latest version, or DeepSeek or Perplexity or whatever you're using. So I don't see it over the next 5 years. I do see a lot of some follow-up communication that you may want to have with your psychologist that could be automated. If you have your CBT, a lot of the your journaling could be you can get nudges to do your journaling or do the exercises that you agreed upon during your CBT session. I could see that being very helpful, um, but not completely. Not I cannot see yeah a full AI agent doing psychotherapy. With that being said, at least in developed countries. But then if you're talking about the developing world, I'm not sure how open the developing world would be to having an AI agent as their psychotherapist.
Talk me through your diligence process. What do you look for in startups that kind of come in your inbox or are introduced to you?
Um, Nothing new here. So team for sure. Um, are they complementary? Do they have enough experience or enough experience in this specific market or in another market, but they bring relevant skills to this market? Have they known each other for a while? Have they worked together? Because partner founder breakups are a very common cause of failure. Um, then the market needs to be big enough. The timing, there needs to be a good answer to why now. And some traction or some kind of validation. If we're talking about healthcare, there needs to be some kind of validation, whether that's some IP for a medical device or some beta testing or some at a minimum interviews with stakeholders where they got consistent feedback and now they're ready to build. Um, that's about it. I think that's the initial screening, and then you have to go into due diligence and really look at are these is this team supporting their claims? What does the competition look like? How are they differentiated from the competition? And go from there.
What are you excited about in longevity medicine? From what I see, there's this inherent belief that we all have, including myself, that more data is better,
Yeah,
which goes against um, Western medicine in a lot of ways because we really focus on pretest probability
yeah,
and
yeah.
is this data useful or will it create more uncertainty? And you can kind of see this in startups. There's a point where you're doing diligence. You don't need more data. You will not get more certainty because the asset class is uncertain. It's a high risk asset class. unfortunately, medicine is uncertain. Healthcare is uncertain, and I don't think this is something patients know or realize. That we can collect as much data as we want. Prognosis and outcome prediction is inherently uncertain. It's a probability. It's not deterministic,
Mm-hmm.
right? We can never predict your future risk of something as 100% or 0%.
Yeah.
And at some point, and I think from a business perspective, it's great because it creates a data flywheel. You order a test, creates uncertainty. You need more testing, more uncertainty, more testing, and this is this loop where it just keeps going. And so it makes sense. And I think it's a massive market opportunity. But would love to kind of get your thoughts. Yeah.
Yeah, longevity is very trendy these days, and longevity means different things to different people. So, anything from I'm just getting blood tests or an extra tests more often to, well, here's why I'm using metformin and rapamycin, and then this new I don't know, NAD injection and stem cell injection. So it means different things to different people at this point. I'm very happy that there's interest in this segment. To answer your question, yes. So traditional Western medicine and evidence-based medicine stresses the fact that there is uncertainty, and that's great. But a couple of things here. So if you have better data, then you can change your pre-test and post-test probability. And what do I mean by better data? So full body MRIs may give you some false positives, but they will cover some edge cases. So they will cover the pancreatic cancer. They will cover the glioblastoma multiforme, like a rare brain tumor. And if you have, a full body MRI at age 50 and it's completely clean, you have an idea that your pretest probability of having, if you go do another test, another, let's say, abdominal ultrasound in 2 years, the chances of having pancreatic cancer have gone down quite a bit, just based on the full body MRI. So I think with technology advancing and technology becoming more affordable, a lot of a lot of preventable deaths will go down. And evidence-based medicine so far has been very useful because we went from this is what just what my opinion is, or this is what this KOL does, or this is how we've always done it, to okay, this is what the research shows, and this is how we use best practices and the best research to harmonize treatment and diagnoses, which was absolutely necessary in the 90s and up to now. But now with technology evolving really fast and hopefully costs coming down, we can have more useful data and cover edge cases more easily. So the rare cancers, but also in terms of prevention, we can catch cardiovascular disease a little bit earlier, or we can catch cancers. We can catch hopefully some autoimmune. We can prevent some autoimmune diseases from developing. So I think that just having cheaper access to diagnostics and wider access to diagnostics is going to help just avoid preventable deaths. Now, is that going to happen right away? No. Is that going to be evenly distributed right away? No. But that's where I think we are going, because just looking at the latest meta-analysis and just trying to base our clinical guidelines on that, already you've lost. There's a lag. Okay, and your statistics are what they are. That they're going to cover most patients, but they're still going to be edge cases. So we're going to have fewer edge cases just by having more useful data. Um, we and there are some examples already of technology really changing the way diseases at least are managed, and hopefully in the future are prevented. So CGM is already helping with a lot with diabetes, and you have a lot more data, but it's useful data, and people are able to titrate their medications better and to have more useful discussions with their endocrinologist. So wearables are going to give us increasingly more useful information. So the Apple Watch was just approved to diagnose sleep apnea. It's already been approved to diagnose atrial fibrillation, and I've had two of my patients get diagnosed themselves with their Apple Watch. And now I'm excited because sleep apnea affects about 10% of the population. And you go through this usual questionnaire that's not very helpful to try to figure out whether they have sleep apnea or not. And the current standard of care is that they just have to go to a clinic, pick up a machine, take it home, and then send the machine back, then see a specialist, and then have treatment delivered to, or have access to treatment. Now they can come to directly to me, and then I can send them to see the specialist. If they want to do some more testing, fine, but at least it's picked up on time.
If you had infinite funding to build a startup in this space, how would you begin?
In the preventative medicine space,
Yeah,
because
how like
I mean, you could have molecular solutions where we just go directly at the mitochondrion, and then just reverse aging, or you stop disease at the cellular level. I don't have any insight. I don't have a lot of insight into that, and I'm glad that people are looking into that. But if we're talking about with what we have now, it would be um something.
would you do like a Neko style from Sweden, like which is like a clinic, or would you do like a function health or something that's more, telehealth with like yeah.
They're converging. The two are converging because Function Health, I think, just bought a full body MRI startup. So I think we are going in that direction. And Neko Health is using a lot of money. So I think that's where we're going. So which means regular blood tests and full body scans. I don't know if I would do them every year, but you could do maybe full body scans every few years, and then in between some liquid biopsies that work better than what we have right now, because nothing works really well from the blood tests that exist in the market. So I think that's very feasible in the next few years until you have the next revolution at the molecular level, maybe cellular level.
Let's say I'm a physician, I graduated from high school, went to undergrad for pre-med, did med school, did residency, did fellowship, and I'm an attending. The only thing I know is medicine.
Yeah,
I know nothing else. And I have a problem in my workspace, and I'm thinking, this is a solution that could work. And then I come across A16Z and Sequoia, and I'm excited, and I'm like, okay, this looks promising. I want to build a startup.
yeah.
Uh, how should I go about what are some mistakes I'm going to make that I can avoid? Um, and what are some mistakes I'm just going to make anyways that are unavoidable? What advice do you have for this physician?
So a lot of the physicians that I see are exactly that, and they tend to be academic physicians, and they want to build something based out of based on their research. And the most common mistake is just trying to do everything themselves and trying to recruit among their either their students or some undergrad or someone who doesn't have enough expertise. So there's a lot of not knowing what you do not know. um, this is the most common problem that I see, and trying to keep all of the equity to yourself and not understanding that this is a completely different game, and your skills have made you an expert in what you do. But building a company, going from I have good technology or good research or maybe even good IP, going from that to I have a successful company, that is a completely different game. And there's ego that gets involved here, or there's just ignorance or what we don't know, which is normal. We all have blind spots. But the number one thing would be to build a team around you. Understand that you don't have commercialization experience. You will need someone to take care of technology, even if you're the chief scientific officer. You need people to build a commercially minded team around you. And the other, so let's say that you get over that. The other thing to understand is that someone who worked at a big pharma company and has 20 years of experience is not necessarily the best co-founder for you. You need someone who has some technical skills or some commercialization experience, but you need someone who understands startups and the uncertainty of startups and the resilience that's required, and to be able to tolerate rejection, whether that's from uh, investors or from the initial customers, where you're going to have setbacks. And you're starting on a new adventure essentially, and then you need the best team, and you need to realize that you're not your previous career has not prepared you for this.
What are if your kids came to you and said, "Dad, I want to be an emerge medicine doctor," what would you tell them?
My kids too, so that would be, and then
In 16 years, let's say.
yeah. um I don't know. Just I would say just get a good idea of what it is. Um, just go shadow a few emergency physicians, and then talk to people who are early in the career. Talk to people who are late in the career. Um, get a feel for the profession, and then get a feel for you know and see if you like it. But I would start the real question here is why, okay, and try to really get to the what do you like about it, what is it that drives you to do this, what are your strengths, what are your weaknesses, and then is this the only thing that will make you happy? I think starting with knowing yourself, um, and strengths, weaknesses, ambitions, interests. Once you get to know that, I think then you can see that there's a lot of ways to be happy, or to have a successful career, or whatever your ambition is, to make a lot of money, or have a big impact in society. And if once you know yourself, you have to identify at least a few solutions. It cannot just be I will be an emergency physician, or die. So identify a few solutions, go try them out. If you think emergency medicine is for you, go for it. And just because you did it for 10 years or 12 years doesn't mean that you're married to it for life. um, so that's how I would address that.
What I would say no. That would kind of be my, and then I'll get into
You
why.
know what? That's been my answer for a few years, but my wife tells me no, no, no. She has to walk me back from that. So
Yeah. Um, yeah, I think my 12-year-old, she has an interest in science, and I can see, and even the 5-year-old, that they're starting to kind of pick on things, and um, starting to go the medical route, and I'm trying to kind of sway them away. But we'll see if I win that battle. What brings you more satisfaction and joy, investing in a team that needs coaching, or investing in a founding team that you're hands off? Do you think the job is to help founders, specifically coaching with scaling and team building and management of that sort, or is the job to just pick the best founders and get out of the way and maybe help them a little bit here and there, but you're not involved that deeply?
um, no, picking the best founders and getting out of their way. Like there's not. I don't care to maximize my impact on within that team. Picking the best founders, it's a difficult decision anyway. Just sometimes just even finding the right team is hard, and then let alone doing due diligence, and negotiating, and everything else that goes with the deal. So no, picking the right team, getting out of their way, that's absolutely fine. Now, if I can help in any way, that's fine. But I do not want to be involved in the day to day. And it doesn't, if you have a lot of a big portfolio, it's not really realistic to say, oh, well, I'm going to help you with this and that, or I'm going to be doing part of the work. Mind you, over the last 6 months, I have been helping a company, but so maybe that's colored by that. But no, it's so delightful. Just getting those updates and things are going up and to the right, and then this new opportunity that gets unlocked, or there's interest by this acquirer. Like that's venture is hard enough as it is. So it's I prefer to have picked a good team.
If you had to pick out of investing in medical device versus digital health, what would you pick?
Oh, medical device is hard. So definitely digital health. Medical device, you have all the technical risk of building something, going through regulatory, and then you have to build distribution, which is very hard. Um,
Which do you think is harder, FDA approval or distribution and market adoption?
I think distribution is harder. I think distribution is harder.
Interesting, because we celebrate FDA approval so much. From it almost feels like the startup has succeeded post approval. They haven't, but I think that's what and maybe it's because both things are so hard. We need to celebrate our successes.
The only thing that I'm going to say here is, oh, you could just get acquired as soon as you get your FDA approval, and that's you. I think that's a great path to exit. There are not a lot of players that will acquire you. Okay, it's been consolidated to 4 or 5 players that do acquire medical device. So you need to probably have built some relationship with one of them or a few of them from before you get your FDA approval. But selling after that is hard. Building your sales force, going after KOLs, that takes a lot of capital, a lot of energy, and you know there's a lot of challenges there, and it takes a bit of different skill set from the team because your CTO is not as active. The technical team is maybe improving the device a little bit, but you need to hire like a second team. Whereas digital health, you know, faster go to market, no defensibility. Yes, um, you may or may not be able to be as sticky as medical device, but generally, with AI, with a lot of the inefficiencies in healthcare, I find it's a better investment, and it definitely fits my background better.
Is it easier to teach entrepreneurship and business to a healthcare expert or physician, or to teach healthcare to a business or entrepreneurship expert?
Um, I think it's easier to have help on board, to have a healthcare expert or healthcare expertise to have access to that when you're an entrepreneur. Becoming an entrepreneur, there's a lot of personality traits that go with it that clinical medicine selects out for, and that are actively discouraged. So I would prefer an entrepreneur who has a great advisor and a few clinicians on his team leading a team, as opposed to a physician by himself, or I don't know, maybe a physician who's well surrounded could do it, but generally I would invest more in an entrepreneur.
Okay, last question, Tanasi. If you could go back in time and talk to your 20-year-old self, what would you tell him?
um One thing is certain, things are going to change a lot, and you're not going to be able to predict how they're going to change. So um just stay flexible, just stay flexible, and success is just for happiness is going from failure to failure without a loss of morale. Just stay flexible, stay resilient, and you're going to end up you know ahead in the end.
Thank you.